My name is Toby Carlsson and I'm one of the Prosthetist Orthotists here.
Morning, how are you doing?
I'm also one of the founders of the organisation. We set PACE up in 2003 and I've been here ever since. Well, I have a full clinical workload, so I spend virtually all day, every day, either seeing patients or dealing with issues related to patients. It's primarily provision of treatment and equipment, but I also spend some time doing medical legal work on the instruction of solicitors. Well, there's lots of different scenarios that we work with, but a lot of the time we have people who have had an amputation, for instance, relatively recently, and they will be referred to us by perhaps an insurance company or a case manager that has been appointed to them. We will see them for an initial assessment, which most of the time is either a two-way or a three-way assessment. It will include a prosthetist, orthotist, a rehabilitation consultant, a physiotherapist, perhaps other clinicians as well. During the assessment, we will establish what the needs are and what the situation is, and plan some kind of treatment and also cost that treatment. We will provide that information to the referrer, and the referrer then hopefully contacts us again and gives us the authority to carry that out. Usually in that situation we will plan for approximately 6 months, and it will be provision of both equipment and training and services and perhaps counselling or other psychological support as well. On the periphery we also have contact with plastic surgeons and orthopaedic surgeons through our rehabilitation consultant, who can facilitate surgical treatment or tests at a private hospital nearby.
Morning mate, how are you doing? Everything okay? Yeah.
We need people to come here and feel comfortable. The last thing we want is for people to arrive here and be stressed and wound up and nervous about what's going to happen to them and how it will all work. So we do go out of our way to make sure that the atmosphere is friendly and relaxed, and when we actually start the treatment, they are then in a good mindset to actually take full advantage of it. We spend a lot of time with each individual and make sure that we provide not just the equipment but also the training and the psychological support that's necessary to make good use of the equipment we provide. And by catering for all those aspects, both the actual equipment, the physical and the psychological side of it, I think we can give people very good support. We always at the outset establish some goals, so we're looking for specific outcomes with the treatment we provide. It may be for somebody to be able to walk their dog, or it may be for somebody to be able to run a 10-kilometre race or go scuba diving on holiday. But whatever they are, they're always specific for an individual and they're agreed at the outset. Well, we're always looking for improvements, and the improvements we're looking for vary with the individual, but we establish where we are starting from, and we then measure what improvement we get. So it could be the length of time people can wear a prosthesis, what they can use it for, or something else, but it's always a measurable improvement we're looking for. Well, the multidisciplinary approach is recognised worldwide, I think, as the best way of providing rehabilitation services. We have wanted to take the best aspects of that out from the NHS, which is very good at providing it, but remove all the funding constraints and the weight of a heavy organisation. So we have a small team who are very expert in what they do, and without restrictions on funding, that can generally provide very good support for individuals, not just in terms of the equipment but also the therapy services, the medical backup and the psychological support. And combining those is the core of a multidisciplinary approach.